Kia ora. We'll get going. Nice short webinar again, this time on cutting down to quit. And we'll be recording this, so if you miss it or your colleagues miss it, you'll be able to see this online. Now, I just want to start off with highlighting that there's lots of different terminology for cut down then quit. So you might hear cut down then quit, you might hear reduced to quit, you might hear and you might hear reduction treatment. Okay, so there's a number of different ways of looking at that. Now, when we're, of course, working in with your clients, there are a number of different ways to go about quitting smoking. And what you know is probably these three. And most of you will be working with an abrupt quitting approach. That is, you've got people coming in to see you. They are ready to quit smoking, usually within the next couple of weeks, and off they go, launching straight into it, setting a quit date, and then doing their very best to remain quit over time. But some of you will be seeing people now that perhaps are not quite ready, or maybe they kind of do want to quit, but they may not be very confident in quitting in the next couple of weeks, or maybe even in the next 3 months. So you've got to be able to offer them some different approaches. And there are two other approaches that you could use. And what we're talking about today is cut down then quit. But there is a flexible quit date option as well. I'm using this quite a bit with Champix, whereby people start the Champix and they choose their own quit date within a 4-week period. So it just gives them a little bit more flexibility as opposed to getting them to set a quit date in the next couple of weeks. And what we're talking about today is cut down then quit. And we're talking about cut down then quit with stop smoking medicines. Remember that reducing cigarette consumption on its own is not always an effective way to go about quitting, because people compensate. So as they cut down, they end up smoking their fewer cigarettes differently. So more intensely, smoking more of the cigarette to get the same level of nicotine.
So what about people who come to services and they might have been thinking about quitting for a month or so, and they've already cut down? So they've gone from smoking 20 a day down to 10, and they come to see the practitioner and they say, oh, I only smoke 10 a day.
Right. I mean, that's a really, and we're seeing that more and more commonly, I think, because of the cost of cigarettes, and people are reducing. But when you're treating those sort of people, my question is, have you always smoked 10 cigarettes a day? Because if they've cut down from 20 to 10 only in the last month or so, then you really have to treat them as a 20-a-day smoker.
So you'd always be looking at their prior smoking rates before they cut down, and then prescribing medicines to suit that.
Absolutely. And especially if you've got people that may have cut down from 20 to 5 cigarettes a day. I mean, great, but now they're probably really smoking those 5 cigarettes pretty intensely. And if you use the treatment algorithm on 5 cigarettes a day, you'll be definitely underdosing them on nicotine replacement therapy.
So they'll still be having strong urges to...
Yeah, absolutely. Yeah.
How far back would you go? A year or 6 months?
It depends. If you've got someone that... so you're asking them, how long have you been down at that level? If you've got someone that said, actually, 2 years ago, I used to smoke 20 cigarettes a day, but over the last year, I've been a 10-a-day smoker, then you could treat them as a 10-a-day smoker.
So their brains and bodies
had adjusted.
Yeah. Okay.
Yeah. So just a really good question, just to make sure you do go back, ask them how long they've been smoking that amount for. And it's especially important for people that have recently cut down, that you go back and say, well, actually, what were you smoking before?
Okay, so just to clarify, so if someone comes to see you and they said, I've cut down to 5 a day, and you say, when did you cut down? And they say from, say about 2 months ago, and they were smoking 20, then you would prescribe something like 20 milligram patches plus 4 milligram gum, even though now they're only smoking 5 a day.
Yeah.
Okay.
Absolutely. Yeah. Now, the cut down then quit approach, as I said, it's with medicines to sort of stop that compensation, and it's not a complete free for all. There are some goals that you'll set with your clients. Now, I've given this example here as a reduction goal over a 12-week period, but this is negotiable. You don't have to say no. It has to be over 12 weeks. Your client might say, actually, I want to cut down over the next 6 weeks. Great, but still set some goals.
Or they might say, I want to cut down over 2 weeks.
Yeah, you might do exactly that. So there's some goals that you'd set along the way. So in this example here, over this 12-week period, I've set goals of 50% reduction or halving every 4 weeks. So in the first 4 weeks, your aim is to go from 20 to 10 cigarettes a day. In the next 4 weeks, you're going to go to 10 to 5. And in the last 4 weeks, you're going to aim to stop smoking completely.
And you would use nicotine replacement therapy to support that?
Yeah, right throughout, I'd use nicotine replacement therapy, usually one of the oral products. Okay, because that's, behaviorally, that's what they're kind of replacing their cigarettes with. You could also do this with vaping as well, right, to sort of have that transition.
So if someone was cutting down from 20 to 10 in the first couple of weeks, what exactly would you prescribe?
So if they were smoking within the first hour of waking, they'd get 4 milligram gum.
Okay.
And I'd say, I want you to reduce your cigarette consumption by half, and I just want you to use as many bits of gum as it takes to help you do that.
Okay. And so after they are cut down from 20 to 10, and then they go from 10 to 5, would you increase?
They're usually increasing the frequency of gum chewing, although they're increasing the number of pieces of gum they'd use a day.
Okay. And you would help them to do that.
Yeah.
Okay.
Now let's just quickly look at these different options. And actually, most guidelines talk about this abrupt cessation, and that's often what you get sort of forced into in your clinical practice because the ministry wants to see outcomes quite quickly. And so most practices goes down this abrupt cessation route. But I think that perhaps more people would join our services if we offered them a choice. And this is where I think gradual reduction has a role to play. Now, there's usually differences in the characteristics of clients that choose abrupt cessation versus gradual or cut down then quit. And this is just from a French study published a few years ago now, but you can see here that those that choose to quit abruptly are usually those that have had a few quit attempts in the past, but they've got really high self-efficacy. They think that they can do this. Okay,
is that what self-efficacy?
That's what self-efficacy. Yeah, it's like I can do it. I think I'm going to be fine.
Okay.
But on the other hand, you've got people that every time I've quit before I fail. I don't manage to do even a day. I've got a history of mental illness. I'm a really heavy smoker. They may not have really had a serious quit attempt before. And they've got this low self-efficacy. They really don't believe that they can do it.
And everyone around them at home smokes.
Everyone around them at home smokes. People, their friends say, "Oh, you'll never do it." You know the people, right? You've got clients like this where you really feel for them. And so I really have to stop smoking because it's costing me a packet now, but I really don't think I can. And those are the people where gradual cessation, might be an option.
So you would recommend to them, you would say, "Hey, listen, what I'm hearing is that, or what I'm thinking for you, it might be really a good option if you cut down gradually with some nicotine replacement therapy, and we'll take it step by step."
Yeah, I think there's nothing wrong though with saying, look, we've got some different options. We can just set a quit date in the next few weeks and go that way, or we can have a flexible quit date over the next 4 weeks, or we can have a cut down then quit approach.
Okay.
So you're giving the power and control back to your clients as well, as opposed to just saying, right, this is, because you might have people say, no, I've got this in my head now that this is what I have to do. So don't assume, but offer the choice.
Excellent.
And as I was saying before, this was a study that looked at patients coming into services. And actually, when you added an option of cut down then quit,
which is what CDTQ
thank you, Grant. Yep, CD, cut down then quit. Offering that actually increased the proportion of people that were willing to come along to services.
Oh, right. Okay.
So, you know, not just interested in treatment, but also starting treatment. When you say we've got a number of different approaches to help you manage your smoking, you know, and maybe it's time we start using that language where it's not about, you know, it's all about quit now. You know, we don't care whether you think you can do it or not. And maybe it's more about, hey, look, we've got some ways to help you manage your smoking. And maybe that would get more people into our services. And again, patients were more likely to select reduction if they were had a history of mental illness. They've sort of got low motivation, more close friends and family who smoke, because they really perceive quitting as a really hard task. And if you can help them achieve some goals over a period of time, where they reach those goals, well, you naturally start to feel better about yourself.
Okay, so the service could maybe use in the advertisement, choose one of these 3 options: stop smoking now, cut down to quit, or have a flexible quit date.
Yeah, absolutely.
And more people will go, well, actually, I fit into one of those, so I'm going to give them a.
Yeah, I think we know a lot of people really struggle, and opening it up a bit, I think also helps that message of, we're not here to judge you. We know how difficult it can be, and we've got some different options to help you.
Okay.
So what's the evidence? Now, these are one of these awful forest plots I'm showing you here.
It looks like the re-entry coordinates for the space shuttle, Hayden.
So this is from the Cochrane Review, and it takes all of the studies that have compared nicotine replacement therapy versus placebo, that's a dummy pill, you know, or nothing at all, and helping people cut down then quit. And overall, what it's showing you is that nicotine replacement therapy compared to placebo roughly doubles the chances of helping people cut down then quit. Okay, and you can see here that most of them actually have used oral nicotine products. Here they're talking about a choice, so it might be gum, lozenge, or inhalator. This one is just gum versus placebo, or inhalator versus placebo. And see there's not here a whole lot of patch cut down then quit. The patch I would add in once they've reached their quit date.
Okay. Just to replace all of that nicotine that lasts. So, and of course, vaping could fit in here.
Yeah, vaping could fit in here as well. But the key point, Grant, is that you've still got a quit date at a point in time.
Okay, so knowing that cutting down to quit while using nicotine gum is helpful for people. If someone has a nicotine patch on, they're using 4 milligram gum, and they're at their last 5 cigarettes a day, so they're still smoking, but they've got a patch on and gum, are they at any risk from nicotine overdose?
No, they're not going to be at risk of nicotine overdose. And we know from studies that have been done that there's no increased risk of smoking on top of nicotine replacement therapy.
So no risk at all?
No.
Okay, that's good to know.
You can also use varenicline or Champix for cutting down then quitting. So this is an indication of Champix, but unfortunately in New Zealand, because we only get a 12-week subsidised amount, it makes it really difficult to use cut down then quit. So in these studies, they use Champix for 12 weeks, and they do that halving every 4 weeks, and then they get another 12 weeks of Champix after that to help them stay quit. So that's 24 weeks of Champix in total. So at the moment, because we only subsidise 12 weeks, they'd have to pay for the other 12 weeks themselves. But I suppose if you wanted to use it in a 6 weeks cut down then quit, and then you've got another 6 weeks of using Champix, you could do it in that way.
And so how more effective is using Champix to cut down to quit than, say, using nicotine gum?
That's a good question. We don't know the answer to that. But what you can see here is that here's people in the active treatment. So they got Champix. 32% of them were quit after finishing the cut down, versus only 7% or so in the placebo group. So you've got this really big difference here. So what's this showing is actually this quit rate's pretty good. It's probably a little bit higher than NRT, but no one's done that head-to-head study yet.
Okay. So it's an option.
It's an option, but just bear in mind that we don't have an extra 12 weeks subsidised. And a question you might ask is, well, is cut down then quit less effective than abrupt quitting? The answer to that is no, actually. There's no difference in the way that you do it between approaches. They seem to be equally as effective as each other. However, if you've got someone coming to see you and say, I'm ready to give quitting a go, I'm all geared up, going to set a quit date in the next couple of weeks, then making them cut down then quit is not useful.
So it's better for them to smoke as normal up to their quit date?
Yep.
Why is it better for someone to smoke as normal up to their quit date, in your opinion?
Well, usually what you're wanting people to do is to leave smoking with a bad memory. You don't want them saying bye-bye to their cigarettes with a tear in their eye, wondering how they'll ever cope. And often what you see with people that cut down is that their fewer cigarettes become more enjoyable, more meaningful. As they stretch out their time of not smoking, they get withdrawal symptoms, their cigarettes take away those really, really quickly. And it becomes harder to leave smoking when you're really seeing them in that way. So that's why I'm saying just smoke as normal, over smoke even, so you're leaving smoking, not believing that it's an enjoyable, life-saving intervention.
Okay, yeah. Okay. So the rule here is that if someone's ready to quit and they're going to set a quit date in the next 2 or 3 weeks, they smoke as normal.
Yep, and just carry on. Let's set the quit date and go on.
So cutting down to quit is not an option for them.
No, and this is what the study showed, that when you've got people ready to quit, there's no point in forcing them to do a cut down then quit. And in fact, their quit rates were significantly lower than if you just had made them go through an abrupt cessation.
Excellent.
Okay. So just to reflect again on what we were talking about before, the goal of all of our treatment services, and that's what we're measuring, is to help people stop smoking completely. But there are different ways of achieving the goal. And I think this is about talking to people and seeing what they'd like to do. For those ready to quit smoking in the next 2 to 3 weeks, as you say, Grant, just get on and gear them up for quitting abruptly. But if you've got people that are a little bit unsure, perhaps especially those with mental illness that are not very confident in their ability to quit, then a cut down, then quit approach might increase their self-efficacy, the belief in themselves over time, and make quitting just a little bit more enjoyable than it has been in the past.
Okay, so could you just go through what you would actually say to a client who you believe would benefit from cutting down to quit? So they've come to see you, you've got the message, I think cutting down to quit is going to help. What would you actually say to them?
Well, I'd again go back to, well, look, having listened to you, I've got an idea of what might be helpful, but let me tell you what we can offer you. And we've got these 3 different ways to go about doing this. One would be what we call abrupt quitting, which is just getting on and do this relatively quickly. So if you're ready to set a quit date, and that's a date that you're going to stick to and do your very best not to smoke after that in the next 2 weeks or so, then we can go down that path. However, if you're a bit unsure about setting a quit date, maybe it's just you're not quite confident in doing it, and that might be what I'm hearing from them, then we've got another couple of options. One, we could let you set your quit date within a 4-week period. That's a flexible quit date. You don't have to tell me now, but let's just start you on the medicines and see how you go. And as I said, Champix works really well in that regard. But if you've got someone that's saying, well, actually, yeah, I'm a bit unsure, I'd say, well, how about, do you think it's achievable where you could cut down first, and we set some goals for reduction, and then quit completely? And I say, yeah, that sounds good. I said, well, what sort of time frame would you like to do this? We could do 6 weeks, we could do 12 weeks. They'll probably tell you, they might, oh, no, 12 weeks is far too long. How about 4 weeks? I said, okay, great. So would it be reasonable for you to cut down, to halve your consumption in the first 2 weeks? So yeah, okay, that sounds good.
So I'll go from 20 to 10 for 2 weeks.
Yeah,
okay.
Yeah. And then when we revisit, we said, did you achieve the goal? I say, yeah, I'm down to 10 a day. It wasn't that hard.
And I'll be using the gum.
And I'll be using the gum, yeah. You say, well, that's fantastic. are you ready to go for the next, what's our next goal? Can we do a halving in a week, for example?
So go down to 5.
No, go down to 5. So yeah, I can do that. So I want you to use as much gum as you need to help you get to that goal, and then revisit them again at that end of that week.
And could you say to someone, you know, if they come back and they say, look, I'm down to 10, but I don't know if the gum is enough. I think you could say, well, have a mouth spray.
Yeah,
or...
you could add more. You could even add a patch at that stage if you wanted to. And you know, you don't have to see them face to face through all of these sessions either. You could do a lot of this by text messaging, right? So you can keep in contact with them to see how they're going, to make sure they're achieving their goals. But it's about setting some realistic goals for them. And again, you don't want to get their quit date just before they're having a big birth. You know, it's about
just before Christmas.
Just before Christmas, yeah. So it's about putting this all into the context of their lived reality.
And you don't want it to go on too long?
I don't think, you don't want to do this over a year, for example. Yeah. Usually I do it within a 3-month period, 12 weeks or so. I do have some people that have spread it out to 6 months, but the longer you go, I always think the harder it is to get them to set that actual date. Yeah, because people get into that whole thing of, oh, well, I'm down to 5 a day now. That's pretty good. I'm saving money. I don't need to set a quit date. So be very clear about there is still a stop completely. There's still an expectation for that, but we're just going to do this in a more gradual way.
So a cut down to quit, it could be the client is sort of hinting at it and you pick up on that, or you might think that it could be something that would be useful for this particular person and suggest it.
Yeah, absolutely. And not everyone will know that this is even an option. We often say, we say we're the stop smoking service. That means stopping completely. And this is about, actually, there are some different ways to go about doing this.
Yeah. And the important thing, though, in cutting down to quit is that you're replacing that nicotine from their tobacco smoke with nicotine from oral nicotine products.
Yeah, that's right. So that was cut down then quit. So happy to take any questions, or you can use the chat system for this.
Are there any questions for Hayden? Are they unmuted?
I think so.
Yeah, everything that was said, we're practicing it now anyway. I guess we just wanted to hook on and keep up with any changes that have been going on. But no, that was really good.
Good, yeah. And I know many of you are practicing this, and it still fits in. Once they've reached their quit date, they enter the program like everyone else, and you're still measuring your 4-week follow-up. So, but it's about having a service that's flexible to meet the needs of your clients. And your contracts allow that, just to reiterate that. I know people think that it's all only about abrupt quitting, but no, it's about providing the best care you can provide.
Morris?
Yeah, I think when you're looking at your reporting, you put it wherever the quit date falls. That's where I'd put it. So I wouldn't. Don't let the reporting get in the way of everything else that you're doing. So the way I deal with this is wherever the quit date falls, that's the quarter that the results go into. If someone pairs smoking with a key activity such as talking on the phone or crossword puzzle, what should we advise to break this pairing during a cut down to quit? Yeah, actually, you can still, during this approach, you can still get people to start thinking about those activities that they often pair smoking with. And, you might want to get them to consciously think about perhaps those are the first cigarettes that they might try and give up. They're often the hardest because they're paired. But if they can get through a telephone conversation without smoking, that's a real achievement. Any other comments? Okay, so how long does it take for the nicotinic acetylcholine receptors to catch up with the decreasing cigarette amount? Not a huge amount of changes actually during the cut down approach. So remembering nicotine from one cigarette is typically enough to saturate most of the nicotinic acetylcholine receptors. So you really don't get that down regulation until they've stopped smoking completely and actually even stopped using nicotine replacement therapy. So I wouldn't worry too much about that. This is really about behavior change and helping them make some steps in the right direction. Are you saying people interested in reducing may be referred to stop smoking services? If so, do they need a quit date? Well, again, this is a cut down, then quit. So yeah, ideally they'd still have a quit date that they'd set. But the key thing here is you're going to be flexible with when that actually is. And I think, yeah, why not support people in reducing to quit? But your conversation is still around making sure, or there's an expectation that there will be total quitting at some point in time. I think with on there, I think people with mental illness or people who are very highly tobacco dependent, the time frame might be prolonged. And you know, I know of several people that I've been supporting for quite some time, and for quite some time I mean over a year, who have had so many things going on in their lives, but they still keep coming back. They're still using nicotine replacement therapy, and to be honest, just having that contact with them. They don't come every single week, but perhaps every month when they come in. It's still an important relationship to maintain. And okay, you don't count that in your results because there's nothing to count, but this work is not all about just reporting on outputs. Okay, well, I hope you found that useful and enjoying these very short webinars. Good luck with everything over the coming weeks, and I probably won't speak to you before Christmas, so have a very happy Christmas with whānau and a safe new year, and we'll look forward to catching up with you in the new year.